Thank you. Next slide, please. Just thank you, honored, humbled, and very grateful to be here with you all. So I think it's important to just start with a little context about Boston Public Schools. It is the oldest public school system in the United States. We serve an incredibly wonderful, diverse student and staff population. We have about 48,000 students, 10,000 staff, and we have 119 schools across 132 buildings. An important note in relation to this conversation is that with the age of our buildings, only a third of them actually have full central HVAC. Another 2/3 rely on natural ventilation, so operable windows for their ventilation, with some limited and supplementary ventilation in about a third of those. Next slide, please. So we've had a long time history, commitment long before the pandemic to indoor air quality management at Boston Public Schools. We follow recommendations from the U.S. Environmental Protection Agency's Tools for Schools program. They have a wonderful schools program around indoor air quality, and they recommend a layered risk reduction approach. So that means implementing many different strategies in parallel, in layers at the same time to address indoor air quality in schools. And so the piece that I'm going to be focusing on, the layer today in terms of technology, is what we did to modernize our monitoring and reporting layer. Next slide, please. So prior to the pandemic, we started conducting market research around live monitoring in our classrooms. And that's because we have about 5,000 classrooms across the district. Historically, we had been conducting indoor air quality testing with manual instruments, which, while that's better than nothing, we all know that's really just a snapshot in time. It's not giving us a full, true picture of what's happening with our indoor air quality in our classrooms. You could take a reading at 9 a.m. when you visit, and then that reading could be with good air quality. You could leave, something could happen later, and you wouldn't even know what's going on. So we looked into modernizing and investing our approach to testing, and so that it would help us better communicate the data, address issues in our operations and our investments, and also be able to be more transparent with our community and do some priority decision making. Next slide, please. So in December 2020, we actually launched an RFP, request for proposals. We ended up signing a contract in spring 2021 with SGS Gulson. Basically, we ended up installing 4,500 sensors across our district. We prioritized sensors in every single classroom, every main office, and every nurse's office across the district. We also decided to put an outdoor sensor on every school rooftop, knowing that the schools span the city of Boston. Different neighborhoods, different areas of the city are facing different ambient air quality challenges, and we wanted to have a baseline at each location. We chose 6 parameters to focus on that were most important for us as a team, and those were carbon dioxide, which we use as a marker for ventilation, temperature and relative humidity to look at thermal comfort, carbon monoxide. We have a number of boilers across the district as part of our heating source, and then particulate matter, PM10 and PM2.5. Next slide, please. Another big piece of our decision to put sensors across the district was to create a completely public dashboard where we are sharing all of the information live at all times. So you could actually visit our dashboard right this moment and see what's happening in our schools. That was a really important step for us in terms of committing to transparency, being able to connect better and communicate better with our own community, and to be able to use this again as a tool to make necessary investments across the district. Next slide, please. So in addition to what you saw prior, which we have district level view, and you can run the district level summary, we also have the school view. Next slide, please. And a classroom view. So again, parents, teachers, students can pull this up on the website and look at their either individual school, a district-wide summary, or even their classroom level. One of the things we're actually hoping to launch before the end of the calendar year that we've been working on is a mobile app. And that's in response to seeing that about 70% of our visitors, likely the majority of our community, is using a mobile device to access the information. So it's, again, very important that we're responding to the needs of our community. So stay tuned on our mobile app. Next slide, please. But just collecting data and putting it out there is not enough, right? Again, back to that visual of layers. It's only one piece to addressing and managing indoor air quality management in our schools. This piece with the monitoring, you actually need to do something with the data. You need to be using it not just for communication purposes, but to actually make improvements and change. So we've been using it in a number of ways in our operations. I'm reporting through facilities management. So we're using this data to work with our HVAC team, our energy division, dealing with thermal comfort, increasing ventilation rates. We're responding to concerns around neighborhood house fires. We are using it to update our policies. We've even used it in both winter and summer times to address, should we have school if there's extreme heat and cold? And next slide, please. We're also been using it to make more greater sort of investments, so capital investments, not just the day-to-day operations. But as I mentioned, one of our greatest needs and one of the greatest strategies we need to help improve indoor air quality across Boston Public Schools is investments in HVAC across our schools. And so we've been able to use this data to make prioritization plans. So for example, right now we have 6 schools going through a design fee phase process where we're collecting feasibility studies from a vendor in order to invest in full HVAC systems in those 6 schools. We've been able to use this work to get some serious grant funding from both the state, support from the city, as well as sharing our story across the world. That was a nice, unexpected outcome of this, and trying to help other schools like us learn from this program, hopefully share our mistakes with them so that they don't have to go through what we've gone through, and just, again, working together to improve indoor air quality across all schools. The last thing I'll mention in next slide, one of the results that's been very important for us as from this program is a research partnership with Boston University School of Public Health. They've been helping us really process and analyze the data points. We are collecting more than 2 billion data points per year. It's a lot of data for operations folks to manage, make sense. So having a research partner to help us has been really critical. And we actually just added a second phase to this research project where we're going to be working with BPS Health Services to start to overlay all of this IAQ data with things like absence data, communicable disease clusters, asthma incidents in our schools. So that's something really exciting and important that we're working on, in addition to using this data to try and make operational investments. And so I can end there. Be conscious of time. Thank you all.